they said this was a mistake. This was a mistake. But for me, it's a metaphor that shows what's happening in Indian country right now. Tribes, rural reservations and villages, urban Indian communities, we are seeing our people suffer and we are seeing our people die. And we are not getting what we need in order to serve them well. And as a result of that, some of the urban Indian programs that want to provide testing can't because they don't have access to the machines, to the testing supplies that are needed. And while they're actively trying to serve their communities, because of the chronic underfunding of the Indian health service system and the inability to get everybody the correct supplies, they're not being able to do that. Our Native people are not being counted in the health data as Native. That means they're being counted as another race instead of as American Indian or Alaska Native for a couple of reasons. The number one being nobody ever asked them. They simply took a look at them and identified what they thought, whatever race they might be, instead of actually asking them. In other places, there may not even be a category in those data systems for American Indian or Alaska Native. And in fact, they'll be counted in a group called Other. And if you're not collecting that racial data, policymakers are not getting the correct information that they need in order to allocate resources and in order to understand where and how we can prevent the spread of COVID in the future. Government, states and counties who want to swoop in and save us, that's not how it's happening. And when they do that and they attempt to push us out of the way or not get us the resources that we need, what we have seen is that those resources never reach the people they were intended for. And we have to work together in order for this to stop. And it has to stop. It has to be directed by tribal leadership, by our national tribal organizations, and by organizations who are doing the on-the-ground work in order to reach our people. Because otherwise, what we'll see is we will see this continue to spread. We will see more deaths. We will see more infections. And again, it impacts more than Native people. It impacts the entire communities in which we live, work, and go to school.